Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Ian Roth.
Are you taking good care of your fingernails and your toenails? Well, boy, we don't overlook anything on Mayo Clinic Radio, do we?
Never.
In the summertime, a lot of people rely on a manicure or a pedicure to make their fingernails and toenails look nice, and not just women. If you get your fingers and toes done together, I've heard women say they're going for a mani-pedi.
I hear it all the time from my wife. But before that trip to the nail salon, it's important that you use some caution. Take a few steps to lower your risk of infection. Here to discuss nail health is Mayo Clinic dermatologist, Dr. Rachel Miest. Welcome to the program, Dr. Miest.
Thank you.
Dr. Miest, good to have you. So I heard Ian say infection. You have to worry about an infection if you're going to get your fingers or your toes done?
Yes, absolutely. It's really important that you take appropriate precautions before you even go to have your mani-pedi. So, for instance, important to know that the facility that you're going to is very clean. So there are a number of different reasons that we can be at risk for an infection, and some of those start with the salon itself or wherever you're having this procedure performed. So that starts with making sure that they're a licensed technician, and that means too that they're following certain protocols, whether that be cleaning the surfaces that you'll be sitting on to the bowls that you'll be soaking your feet in. All of that is really important because bacteria, viruses, fungi can all be on those surfaces. And so that's number one. Do your homework before you go.
So you want to make sure that they have a license.
Exactly.
And is there somebody who comes and checks the salon every once in a while?
Well, the other piece of this is that I think because your safety can be at risk, now, of course, this is a low risk, but it can be at risk. I think it's never a bad idea to ask some of these questions. Certainly you can ask, what is your protocol? What do you clean with? Is there someone, a safety inspector or whoever it may be that comes in? So absolutely, you can ask those questions. Oftentimes they do have their license visible either at the front or at each individual station. So I would encourage individuals to look for that. So that's sort of the first thing, is do your homework, make sure that you're going to an establishment that has a good reputation and that is safe. And then once you get there, it's never a bad idea to look around and see, is this a safe environment? Do you see them cleaning the surfaces? If there are tubs, particularly jetted tubs, do you see them putting solutions, whether it be soapy water or cleaning solutions into those tubs for 10 minutes and running them and letting them really clean, and sort of looking at their practices? Where are they getting their tools? Are the tools clean? Have they been soaking? So lots of different things you can look for if you get to your appointment just a few minutes early. And then what can you do? The biggest thing, particularly with pedicures, is really not to shave the legs at least 24 hours before that appointment. And that's super important because even if the surfaces are clean, there are still these, bacteria and fungi all around us in the water. And so if you shave, you can cause little micro cuts in the skin. Even if it's not a big nick that you know about, there are still micro cuts there that can be a way for the bacteria or fungus in particular to get into the skin. So super important, 24 hours beforehand not to shave. And then another thing that you can do once things have gotten started is really the cuticles should not be cut or aggressively pushed back.
All right. Now, I got to ask you about cuticles because I
Yes.
remember my mom's, she would always say, well, push your cuticles back. So
Yes.
I honestly, and I went to medical school, but I thought the cuticle was that skin at the very back of your fingernail. But it's
Yes.
not the skin, is it?
No. Well, it is. It is. It is a thin layer of skin, but it's a protective layer that really sort of grows out from the base of the nail and protects things from getting under that nail.
But it's not the skin itself. I mean, it's like that dead
It's
skin.
dead skin, exactly.
It's
exactly.
the dead skin at the back of the nail.
At the back of the nail.
Okay.
And it is really mostly or almost purely cosmetic that we want to push that back or clip it. Pushing it back gently after the hands have been soaked is reasonable, but you really got to be careful because when that barrier has been broken, that's when you can have infection set in. So even if the tools are clean, the surfaces are clean, if the cuticle is clipped away or aggressively pushed back, you're basically putting yourself at risk for an infection.
Is that the main site of infections when we're talking about fingers and toes? And is that where you see it most?
I would say it's a combination of the cuticle, but then also I think occasionally, and it's I wouldn't say that it's human nature to either when you're clipping or filing to go a little bit too far and cause breaks in the skin that way. And it may not just be around the cuticle, but around anywhere around the nail itself. So anytime that there's any break in the skin, whether it's technician dependent or something that you have had prior to the service, I think it's sort of a combination of all of those.
So it's okay to push the cuticle back,
Gently
but you shouldn't cut the cuticle. What about scraping it?
I think anything that would cause that type of shear force, I would worry about as well, that it would cause even little micro tears that could potentially put you at risk for one of these infections.
What advice do you have for us about taking care of our fingernails at home without going to the salon?
Yes. So I think sort of tying the two together, painting the nails or having the polish applied during a manicure pedicure is not necessarily bad. There are certain individuals who could be allergic to some components of nail polish, so that's important to know if you have sensitivity to that. I think it is important to give your nails a break from having nail polish occasionally. Now, that's important for a number of reasons. One, it's important to see the nails. Nails can be a huge reflection of your overall health, and so it's important not to mask any potential underlying issues. And that could be anything from a nail fungus, so something superficial, or it could be more of a systemic issue. So I think having these services done is not inherently dangerous, but I think doing it intermittently and giving your nails a break every once in a while is helpful, because over time, those different things that they might do, whether it be buffing the nails or filing the nail surface or just the actual polish on the nail, can lead to thinning of the nail plate. And again, that's a super protective thing that your body has done, and so it's important to keep that intact. And so, minimizing things like wet work, that's something that, again, in the spirit of keeping those nails hard, over time, wet work can soften the nails. It can put you at risk for fungal infections, etc. So something to keep in mind if you're doing a lot of food prep or you do a lot of dishes, things like that, then it's important to be wearing protective gloves. And then really just keeping them trimmed, keeping the, if you, not pulling. If you have hangnails, that's okay to clip, because anything that you pull around that area, again, can go a little bit deeper than expected and leave you with that susceptibility to infection. And then really, I think it's always helpful, particularly up north here where we have such long, dry winters, it's really important to keep the hands and the nails and the skin surrounding the nails moisturized. And that's just as simple as using a hand lotion throughout the day, particularly in the drier winter months.
And what's the best way to cut your fingernails?
The best way is to cut them straight across. You want to be careful. Sort of the main important thing with that is you want to be careful not to cut the corners so rounded, because that's particularly in the toenails where you put yourself at risk for ingrown nails. So a soft rounded corner is totally fine, but you do need to be careful, because if that's too sharp of a curve there, then that's really when you get yourself into trouble.
A lot of people are, particularly women, are interested in having harder fingernails. Mm-hmm. The nutritional supplement biotin, yes, I've heard, can potentially harden your nails. Does it work?
Biotin does work for the nails. The data does show that it does lead to stronger nails. The one common question that we get is related in the sense that biotin is often the main ingredient in hair and nail supplements. The data is not as strong for hair, and so really, though, for the nails, it does show that it can strengthen the nails, but you do need to be careful with biotin, because there is some recent data to show that it can affect certain laboratory tests. So it's really important that your patients are aware of that if they are taking it.
So it probably works, but you want to tell your physician that you're taking it before you have any blood tests.
Exactly.
All right, one final question. We need an update on toenail fungus, because a lot of people have it. I know it's extremely difficult to get rid of. You would agree, or do you have some better treatments than we used to have?
I wish that I did. I really do. This is a super common question because nail fungus is so common, particularly toenail fungus. And so no, unfortunately, it remains a very, very stubborn disease. We see a lot of it. It's more common as we age. And unfortunately, the treatments that we have don't work super well. And so our topical treatments, really about 15% of the time we can see a response, and that's really when you've used it.
By something you rub on the toenail.
Exactly,
Yeah.
exactly. And then otherwise it's pills by mouth that you need to take for anywhere from 6 to 12 weeks. And that has a little bit of a better response rate, but some potential side effects. So unfortunately, in general, if it's not super bothersome, we sort of weigh the options of any treatment at all. And it's something that they are always coming out with new things. Unfortunately, even some of the newer things don't work all that much better than the old standbys that we have. So unfortunately, I don't have any good news on that front.
All right, so if you've got toenail fungus, you might want to keep it for now.
Probably.
All right, everything you wanted to know about manicures and pedicures, mani-pedis with dermatologist Dr. Rachel Miest at the Mayo Clinic. Thanks so much for being with us, Dr. Miest.
Thank you for having me.
Thanks for joining us.
Yes.